In today's video, we're going to talk about what good physical therapy looks like versus just working with a physical therapist or a rehab specialist that just has really good bedside manner. So let's jump right in. So I thought this was an important topic because I was just on a consultation with a prospective low back pain client a few weeks back, and we were talking about his back pain experience, things that he's tried in the past, things that he's currently working through. And one of the main points that we discussed at length was his physical therapy. So he said he had done multiple rounds of physical therapy, each lasting about 6 weeks, and he was going twice a week, so 12 visits each time. And before I started asking more specifics, he just offered, hey, there was nothing against a physical therapist. They were great. These guys really knew what they were talking about. I really, really enjoyed my physical therapy. I just don't think I have a back that's going to respond to physical therapy. I was listening to what he was saying, but I definitely had some follow-up questions. So I said, okay, well, just outline what they were doing with you. So he said, okay, each session they would do some muscle stim and some heat. And then after that, they gave him a few stretches to work on. So it was child's pose, figure four stretch, and stretching the hip flexors. And then they were having him do glute bridges. And I said, okay, great. And so what else did they have you do? Like what was the progression from there? And he just said, well, that was it. And I said, okay, so you went to physical therapy for 6 weeks. They gave you child's pose, figure four stretch, stretching the hip flexors, and glute bridges. And he said, yes. And you did that for 6 weeks. And he said, yes. Both times of physical therapy, you did that for 6 weeks each instant. And he said, yes. And I said, well, I don't want to be, the bearer of bad news here, but I think you just had a really poorly designed physical therapy program to help get you out of your chronic back pain. I mean, it was blatantly clear that if you're in a program or you're seeing a physical therapist, a back specialist, whoever it is, that if that is what they're doing with you for 6 weeks straight, that is a big warning flag that should be waving in your face that you've got to find a different therapist or you got to find someone else to work with, because that is just subpar. So after I spoke with him, he seemed to understand a little bit of where I was coming from, and it's not his fault, and it's not your fault if this is something that has happened to you as well, that you are going into a system that's designed to help you with your chronic low back pain. So you're trusting the professionals, and you are trying to be a good patient. You're trying to listen to their recommendations, and they're giving you exercises. You're going to do those exercises. But if the plan just isn't there and there's no progression for 6 whole weeks, that's a big problem. So I want to just share a few tips that you can really use and you can look at and you can say, okay, hey, am I getting the best possible care for my situation, for my chronic low back pain, or do I need to pivot? Do I need to work with someone else? So there's really what I consider 3 signs that you need to look at to determine whether or not the physical therapy approach or the back rehab approach that you're going through is effective or will be effective for your situation. So the first is that it should start with an individualized, personalized plan based on where you are currently at, with the goal of getting you to where you want to be. So the very first appointment, the physical therapist or the rehab specialist should be asking you, hey, what are your goals? What do you want to get out of this? Where do you see yourself 6 months from now? Where do you see yourself a year from now? What are your favorite activities? And once we can figure that out and see what your true goals are, not just decrease some pain, but really what do you want to get back to doing, then you can set up a progressive treatment plan that's specific for you, the person that's dealing with the low back pain, and it evolves as you're going through the process. So that's the first step. If you're working with somebody, they should be able to sit down with you and explain, like, hey, this is what it looks like long term. These are the check-in points that we're going to be doing. we're going to be gearing this towards, reducing some of your symptoms, increasing your function, and getting you back to those activities that you want to do. Does that sound good? And then, yeah, you should say, yeah, that sounds great. That's exactly what I want. So that's the first. Now, the second is having communication with the person that you're working with to ensure that you're making the progress that you should be making. So in the traditional paradigm, people will see a physical therapist, rehab specialist, a couple times a week for a few weeks. And most of the communication stops at those appointments. So they'll go in, they'll maybe be given a set of exercises, and then after that hour-long appointment or so, then they go home, and then they're left to their own devices to figure out, okay, I'm doing these exercises on my own. Am I doing them right? Am I doing it wrong? I don't know. And you don't get that feedback until you get to the next appointment. And in some cases, I've talked to people on the phone that they say that, they'll see a physical therapist once and they won't see their physical therapist for another 2 weeks. So that is a lot of missed opportunity there, where you're given exercises and then, okay, do these, hope, best of luck when you're at home doing those exercises. And if you have questions, well, we'll talk about it next time you're here. But that's a 2-week period where if you have the ability to email, text message, message through an exercise app, whatever it is, where you can say, hey, I forgot this part of the exercise. Can you explain that real quick? Or, oh, I'm having pain with this exercise. What do you think about that? And that gives the physical therapist, the rehab specialist, whoever it is, the coach that you're working with, the opportunity to guide you through that particular question. And they can say, hey, yeah, that's actually okay for where you're at right now, based on your pain level, based on your experience, keep pushing through that. That's totally okay. Or actually, that is a little concerning. Let's swap this out. I want you to try this exercise and tell me how that one feels. Oh, that one feels good. Great. Keep doing that one. And then the next time we touch base, then we'll, explore new exercises or whatever it is. So that type of communication is what will allow faster progress through these chronic injuries like chronic low back pain. If you're constantly waiting for feedback and waiting for permission to progress or regress, then that is going to create a lot of plateauing and eventually falling off of a treatment plan, because patients aren't going to see the results they want to see. So now the third point that I think is really important in finding the right physical therapist, rehab specialist, is that they should be working with you and coaching you on how to manage your symptoms independently, meaning that you don't always have to rely on seeing a physical therapist or a chiropractor or these other providers that are meant to help with low back pain. That they should be educating you on, how your back pain is presenting. They should be educating you on the tools and the plans that you can put into place on a day-to-day basis to help minimize your pain and keep making progress. So when you're 6 months out, 12 months out, 18 months out, that you know how to manage these symptoms, you know how to keep making progress in strength, mobility, whatever it is that you need to be working on, that you now have those tools in your toolbox. If you're going to your physical therapy appointments and they're just hooking you up on some passive therapies, they're stretching you out, giving you some very low-level exercises, you're never going to get that level of empowerment that you need to actually overcome your back pain and manage it on your own. That you're going to be stuck in this paradigm of always needing to see somebody, get this fixed, get the pain to decrease, and then, it flared up again, and then you're back in the system. So again, working with somebody who is going to be educating you and showing you how to keep making progress for the rest of your life. That's the ultimate goal. So going back to the title of this video, what is good physical therapy versus just a nice physical therapist, that, of course you want to work with somebody who's going to be kind, who's going to be empathetic, and is going to be able to communicate with you in a positive way. And at the same time, you do have to have a lens on that can look at, okay, I really like this person, their office is beautiful, I enjoy coming here, but you got to go through those 3 steps I just outlined to say, is this the best place for me? Can I see myself overcoming my pain by sticking with the program that this person is laying out for me? And if you honestly can't say yes to those 3 check marks I laid out, then you got to move on to somebody who is going to be able to give you the plan that you need to overcome your lower back pain. So thanks for watching the video. I hope you found this information helpful and something that you can use to help find the right program, the right person to help you overcome your chronic low back pain. And if you haven't already, please like the video and don't forget to subscribe to our channel. Our goal is to release more and more content like this so we can help people with chronic low back pain just navigate them through some of the complexities and nuances around their condition. And if you have any questions at all, please comment in the box below. Happy to answer any questions you might have. And if you are curious about how we help people overcome their chronic low back pain through our online coaching program, there's a link in the description that will take you to our webinar that will talk a little bit more about who we are, what our coaching philosophy is, and what the resilient back method is, the method that we use to help people overcome their chronic low back pain, some in as little as 30 days. So if you're interested, click that link and it will take you to that webinar. Thanks again for watching. See you on the next video.